When anxiety becomes overwhelming, medical treatments can be an effective part of managing symptoms. While therapy is often the first line of treatment, medication can also provide relief, particularly for those with moderate to severe anxiety. It's important to work closely with a healthcare provider to determine the best course of treatment, as different medications target different aspects of anxiety. Here's an overview of the most common medical options used to treat anxiety. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our mental wellness hub on the Happy app. Click the links in the description. Antidepressants are often the first choice for treating anxiety disorders, even though they are primarily used to treat depression. These medications help regulate the balance of chemicals in the brain, such as serotonin and norepinephrine, which play a role in mood regulation. 1. Selective serotonin reuptake inhibitors, SSRIs. How they work. SSRIs increase the amount of serotonin in the brain, which can improve mood and reduce anxiety. They are considered one of the safest and most commonly prescribed medications for anxiety. Common SSRIs for anxiety: sertraline, Zoloft; escitalopram, Lexapro; fluoxetine, Prozac. Benefits. SSRIs are effective for various types of anxiety, including generalized anxiety disorder, panic disorder, and social anxiety disorder. Side effects. Common side effects include nausea, headaches, and sleep disturbances, but these often diminish after a few weeks. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. How they work. SNRIs increase both serotonin and norepinephrine levels in the brain, helping to balance mood and anxiety levels. Common SNRIs for anxiety: venlafaxine, Effexor; duloxetine, Cymbalta. Benefits. SNRIs are particularly useful for GAD and are also prescribed for anxiety-related depression. Side effects. These may include increased blood pressure, dizziness, and digestive issues. Diazepines are a class of medications that work by calming the nervous system, providing rapid relief from anxiety symptoms. These medications are typically prescribed for short-term use due to their potential for dependence. 1. How they work. Benzodiazepines enhance the effect of a neurotransmitter called GABA, which has a calming effect on the brain. This helps to reduce feelings of panic and anxiety quickly. 2. Common benzodiazepines. Alprazolam, Xanax; lorazepam, Ativan; diazepam, Valium. 3. Benefits. These medications work very quickly, often within 30 minutes, making them useful for acute anxiety or panic attacks. 4. Drawbacks. Benzodiazepines can be habit-forming if used for long periods. They are usually prescribed for short-term relief or on an as-needed basis. Side effects include drowsiness, dizziness, and memory problems. Over time, there's a risk of tolerance, meaning higher doses may be needed to achieve the same effect. Beta blockers are primarily used to treat heart conditions, but they can also be effective for managing the physical symptoms of anxiety, such as rapid heart rate, trembling, and sweating. They are not typically used as a first-line treatment for anxiety, but can be helpful in specific situations. How they work. Beta blockers block the effects of adrenaline, helping to calm the physical symptoms of anxiety, particularly in situations where people experience performance anxiety, like public speaking. 2. Common beta blockers for anxiety. Propranolol, Inderal; atenolol, Tenormin. 3. Benefits. Beta blockers are particularly useful for performance anxiety or social phobia, where physical symptoms like sweating or a racing heart can be debilitating. They work quickly to reduce these symptoms without affecting mental clarity. 4. Side effects. Side effects can include fatigue, cold hands, and dizziness. They are generally well tolerated, but aren't recommended for people with asthma or certain heart conditions. Buspirone is another medication that is specifically designed to treat anxiety. Unlike benzodiazepines, it is non-habit-forming and is often used as a long-term treatment for chronic anxiety. 1. How it works. Buspirone works by influencing serotonin receptors in the brain, though its exact mechanism isn't fully understood. It helps to reduce worry and anxiety without the sedative effects of other medications like benzodiazepines. 2. Benefits. Obuspirone is most commonly used to treat generalized anxiety disorder, GAD, and is a good option for people looking for a non-sedating, long-term anxiety medication. It doesn't cause drowsiness or dependency, making it suitable for long-term use. 3. Side effects. Side effects are generally mild and may include dizziness, headaches, and nausea. It can take a few weeks for the full effects of the medication to be felt. Several newer treatments are being explored for their effectiveness in treating anxiety, particularly in individuals who do not respond to traditional therapies. 1. Ketamine. Oh, how it works. Ketamine is a fast-acting drug that has traditionally been used as an anesthetic. Recently, it has shown promise in treating anxiety and depression, particularly in individuals who haven't responded to other medications. Oh, benefits. It is sometimes used for rapid relief of severe anxiety symptoms, particularly in treatment-resistant cases. Limitations. Ketamine is usually administered in a clinical setting, and its long-term effects are still being studied. It is not a first-line treatment, but is considered in severe cases. 2. Transcranial magnetic stimulation, TMS. Oh, how it works. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It has been found to help reduce symptoms of anxiety and depression. Benefits. TMS is helpful for people who don't respond well to medication or therapy. It is non-invasive and doesn't require anesthesia. Side effects. Side effects are usually mild, such as headaches or discomfort at the stimulation site. These videos are made possible thanks to our amazing sponsors. Meet anyone for anything on the Introducer app. Whether you're looking for friends, romance, or something in between, Introducer has you covered. Download for free today. Experience a new heaven and a new earth in a virtual paradise and global community. Church has never looked like this. Your contribution can bring Earth 2.0 to life. Finally, if you'd prefer to watch these videos without ads, visit our mental wellness hub on the Happy app. Click the links in the description. Finally, although this course was free for you, it was not free to get it to you. Please consider giving a small donation to help spread these courses around the world to those most in need. The link is in the description. See you in the next lesson.